Hi everyone. My name is Anusha Samanth, and I am currently serving as the ASA Medical Student Component President-elect. I am thrilled to be joined today by the Program Director and Associate Program Directors for VCU's Anesthesiology Residency Program, Dr. Prasanna, Dr. Webb, Dr. Trollster. Thank you so much for being here today. To start us off, could you each go around and share a little bit about yourself and how you came to be in the role that you're in for the residency program, and how long you've served in that role?
Good morning, Nusha. First of all, thank you so much for this opportunity to talk and discuss about our program and also provide some helpful tips to the future anesthesiologists. And thanks to the ASA as well. So I am Prasanna. I've been the program director since 2021, so over just 4 years. And I was the associate program director prior to that. So my story, I did my preliminary anesthesiology training in United Kingdom, so National Health Service, and I decided to do a residency here in the United States for board certification. So I did residency at Bay State Tufts. I joined VCU in 2013, so I've been here as a faculty for over 12 years right now, and that is my journey. And what was the second question?
It was just that how you came to be in this role, but I think you've
Oh
explained
yeah,
that.
so yeah, I always enjoyed working with the residents, teaching, and over time, even when I was in England, we are essentially paired with our junior residents. And back in the days, the attendings were not in-house, so you are the attending as a senior resident. So that was kind of ingrained in my training. And we talk a lot about teaching. But I was really fascinated with the learning aspect of anesthesia, the journey of an anesthesiology resident through the residency, or any resident for that part. The over time, I realized that there is a learning piece, but there is also a growth piece. You're also growing during the residency. You're growing into a leader. You're growing into a mature clinician. So the program, as a program director or associate program director or anybody in the program leadership, you are in a position to impact that in a positive way, providing that environment for the trainee to grow as well as learn. And that, I think my role as a program director, one of the most enjoyable part is to have that vision, which shared with Dr. Webb and Trossler, to provide that learning environment. So yes, so that's how I would describe my role. Thank you.
Thank you, Anusha. I did want to really kind of piggyback off of what Dr. Prasanna said, and really thank you for doing this interview with us, and you having this platform with ASA. I really do appreciate you doing these interviews, helping out prospective residents. But a little bit about me: I did my med school at Howard University, local to the area. So I grew up in Northern Virginia, went to University of Maryland for my residency, and from there, really wanted to do cardiac anesthesiology. Interested in coming back to Virginia to train. So I was looking at programs up and down the East Coast, really enjoyed what VCU's fellowship program had to offer. And thankfully matched here for cardiac anesthesiology back in 2020. So finished fellowship 2021, and was on for about a year as faculty. And I think just because of my interest in teaching, I really did shine through, and kind of my dedication to the growth of the resident. So joined on as associate program director in 2022. So it's crazy. It's been 3 years so far, but it's been a fun 3 years, but I've enjoyed it. But I really do appreciate being part of the residency leadership here at VCU.
And thank you. I started at Georgetown for medical school, and then ended up matching into general surgery, aiming for plastics. Did several years at Stony Brook in general surgery before deciding that I needed to switch my life and my career goals, and then came to VCU for anesthesia residency as one of the R-spot matches. After that, went to Pittsburgh at UPMC for liver anesthesia fellowship, abdominal transplant anesthesia, and then joined back at VCU. I've been back at VCU for about 4 years now. I'm also fellowship director of the liver transplant anesthesia fellowship at VCU. And I've been doing this for about 6 months now, since our last APD stepped away for another opportunity. And after winning 2 teaching awards from the residents, I realized graduations tend to be very boring things when you're the ones graduating because they're really for your family. But I found as the teacher role that I just felt this upswelling of pride in the residents and how much my teaching just seemed to be able to impact them and who they became. So decided to take a swing at helping the program itself out.
Great. Thank you all so much for sharing kind of your unique journeys to being in this role in the residency program at VCU. Really appreciate that. And to start us off with our first kind of question, which hopefully will be an easy one, what do you love most about your program at VCU? Dr. Prasanna, if you want to start.
Yeah, sure. I mean, I would, obviously my favorite part of being VCU is the culture, and I'll let Laura and Mike talk more about it. I would say, as a program director, my favorite part is probably the well-roundedness of the program, and with the help of Mike and Webb and residents and faculty, what we've created. And again, going back to what I said earlier, the learning and the growth, and I think how we balance those 2 elements, I think that's probably my favorite part. The learning piece, we have world-class clinical training. This is one of the busiest liver transplant centers in the United States. Busy regional OB, children's, the busiest trauma center in Central Virginia. The clinical training elements. And then we complement that with the protected day for didactic. There's a lot of educational piece, Dr. Webb will be talking more about it later. But the second part, which is the hardest things to balance, like how do you provide the growth? How do you address the growth part? The necessary skills for an anesthesiology resident to become a consultant anesthesiologist, a mature consistent consultant anesthesiologist in 3 years. I think that's where we really shine. So the growth piece is where we have a leadership, formal leadership training, longitudinal mentorship, quality improvement, patient safety curriculum. There's so many different elements. Like, I mean, I can go on and on about it. Like the global health track, the patient the advocacy and health policy track, and so on. And there's one more thing that I think we are all proud about this program. I think Mike briefly mentioned about it, is how we recognize our residents. We've all been through residencies. I mean, it's hard. Residency is hard. Anesthesiology residency is double hard because our medical schools are, not preparing or have not prepared us to become anesthesiologists. You have to learn a lot of new skills in the operating room when you come out of the med school to become an anesthesiologist. And a little bit of recognition that goes a long way. So we have implemented a number of ways to recognize our residents. We have newsletters, we have awards. Some of the awards have like funding and endowment. We have praise for residents. So I think the balancing the clinical training with the growth piece, and then making sure we create, one of the best nurturing environments. That balance is my favorite part, I would say. But I'm curious what Laura and Mike have to say.
Yeah. Yeah, I would say, if I kind of thought about, what my favorite part about it is, if I could put it into one word, I think it would be collaboration. So the collaboration really between the faculty within the faculty group, as well as the collaboration between the faculty and the residents. So I think it's great, even from being an intern, CA1, CA2, CA3. My big emphasis is on feedback. So I think, it's a program, we have 15 residents per class. It's not a huge program, but I think something that I really do try and impress on even our interns is that they do really have a say in what their rotations look like. If there is an issue, our doors are always open, but it's really that collaboration between the residents, even interns, and even residency leadership, so that we can do our jobs, which is really to build the best residency program that we can. So I think that's really my favorite part, is kind of the collaboration, the ability to work with the residents, and really focus on what we're here for. And it really is to make sure that we provide the best program that we possibly can for our residents.
And it's the same reason I decided to come back to become faculty. For me, it was the relationship between the resident and the faculty. I've worked at a lot of different places, and sometimes people are not friendly, let alone friends. But the faculty here were friends. There are a number of different groups that go on vacation together. And I saw that and I thought, I could work here. This seems like a great place. There were faculty and previous administrators who were just like, oh, you just call me Paul, call me Spencer. And there's like, I'm just your junior colleague as the resident to the more senior colleague as the attending. And we're doctors, we're all trying to take care of patients. And if I can provide that education as the faculty and try and foster that relationship, that's my favorite thing about the program. And with this longitudinal mentorship program, initially I had the largest mentee group, and they just kept adding to the group, and it made me feel so proud that these people just trusted me enough to come to me with their problems, their solutions, and just to support each other and to have me support them.
Wonderful. Thank you all so much for sharing that. I can definitely tell there's this theme of the collaboration and kind of, the friendship that you have amongst your program, which I'm sure, as future residents, the people viewing this are really excited to hear about. So thank you all. And so transitioning to talking a little bit about the residency application itself, how does your program weigh the different components of the application? So experiences, scores, letters of recommendation to determine who's going to get an interview or who's going to get an audition rotation. And is there any weight that's given to letters of recommendation that come from audition weights that carries more than, say, from another place?
All right, if you want to take a dig at that first.
Yeah, I think it's a tough question, especially when, I think applying into anesthesiology residency is very competitive these days. So, we're not a program that only looks at your board scores. We're not a program that only looks at how much research you do. We really are a program that looks for those residents that are very well-rounded, as well, has the research experience, has the volunteer experience, shows us that they're really working on not just focusing on their academics, but also, what are they doing outside of med school. So I think that's really, kind of a vague answer, but it's tough because, we do look at everything. But again, I don't want to discourage people from applying to our program just because they don't think they have the highest board score. That's not all we look at. But I do want to emphasize that is something that is important, especially when it is a competitive environment. But still do well on your board, still do all those things, but it's not something that we focus on. We do really want to make sure that our prospective residents have those volunteer work experiences, and all of the other things kind of outside of med school that they can bring those experiences and come to residency kind of more as a well-rounded resident.
Yeah. I mean, I totally agree with what Laura just said. Um, I think the message to all the medical students from us, like I'm sure the other program directors across US would agree with this, is we've just become one of the most competitive specialties in the last, like especially post-COVID. We've always been competitive, but in the last 5 or 6 years, it just become more competitive. So I think the individual students, just need to be aware of that and have some sort of, have a good insight of, the strength and weakness of your own application. I think that's an important element. Now, as Laura mentioned, yeah, we do a holistic review of all the applications, and I mean the word holistic has become such a cliche these days. But I think what we do differently, I'm not sure about the other programs. I think we also put everything into context. When we are opening the ARAS and looking through a student's application, we look at everything, including which med school they are from. Did they have enough access to research publications? When you talk about these additional elements, we have to, we know that there is a disparity between different med schools nationally in terms of access to scholarship, academic and scholarly activities such as research, publications, and QI projects, and we are aware of that. And how do we put that into the context of application of this particular applicant? So that I think that's where we make sure that the individual student in front of us, the CV, that individual made the most out of the opportunities they were provided by their med school and by their surroundings. So yeah, the story of the journey of the student from the undergrad, as Laura mentioned, all the activities, be it volunteerism or research, and put it all into the context. Did this individual excel, went over and beyond to achieve what they've had? Putting in that, what's on that CV. It's so obvious if somebody has run that extra mile. It will be obvious in their CV. So yeah, I think the factors outside your CV, such as the connections, and we'll talk about signaling and all that stuff later, that also really matters. The letters of intent. Do we know this individual? Did this student rotate with us? During the audition. To your question about the audition rotation, at VCU, the School of Medicine has a committee who selects and let the students rotate with us. The program does have some input into who will be rotating with us, and it is again very competitive. The audition rotation is becoming more competitive, every year. But the bottom line is, as Laura mentioned, we have a score inflation, we have a grade inflation. So just make sure you've performed really well as a medical student, and we are so competitive to the point that just address all the elements of the application, irrespective of your medical school or background. That would be my 2 cents.
It's a funnel where you have, applying to medical school, you have thousands of people applying for hundreds at every school. And there may not be enough people to read all of the personal statements. For all of the people that are applying for the 15 spots, I read the entirety of their application, from their MSPE to their letters of recommendation to their personal statement. And I remember for medical school, it was just don't make any errors. Be generic. It's fine if you don't have anything to say. Once you've gone through medical school, hopefully you have more experience, something to say. Things tend to be very generic. And that's okay. It may weigh against you as You're not as clear in your writing, as engaging, but the same thing with the letters. Most letters are generic. I had a student ask me for a letter after working with me for about 3 hours. And I think he had 1 more hour to go, and it was on a single day. And I told him, I can write you a letter. It's going to be very generic. We didn't work together. We didn't have any experiences together. It's been today. And I told him, if you want this from me, that's fine. I'm not anybody. I'm not known outside of VCU and the few places that I've been. It means something who the letter comes from, but it means more that it shows that it's they genuinely know you. If we know somebody and we see a very generic letter, it doesn't mean as much as if I don't know them and they have something glowing to say about you. But that said, it's a small community. If you know somebody who's come here and they're willing to make a phone call, that's weighed into things. It is a small-ish community for anesthesia, and if we know you and we trust you, or you've trained here and you know the caliber and the quality, this factors into it. Be well-rounded. I have to want to work with you at 3 a.m. or at 9 a.m. And we have to be able to work together through that stressful situation.
Great. Thank you all for sharing. I think it'll be really reassuring for our viewers to hear kind of, echoing Dr. Prasanna, what you mentioned about viewing the application and the applicant in the context of, where they went to school, the access to opportunities, but always, striving to make the most of what you have and making sure you can have that well-rounded application if you're able to. And so I know you mentioned we'll talk about signaling, so I'll go ahead and ask that question now. How does your program view the different gold, silver, and geographical signals that applicants can send programs, and what strategies, if any, should applicants be using to signal different programs to kind of maximize their options?
Yeah, so I would be just to be honest with you all. The first thing when we open an application in ARAS is the signal. So the signal is literally, I'm sure most programs would agree with me. It just shows how interested you are in our program, and that literally spikes the interest from our side. So, and if you look at our Residency Explorer data, I'm sure you'll find that almost everybody that we matched in the last few years are the signals, the medical students who gold signaled us. So we do interview silver signals, and we do obviously, we're totally open to recruiting silver signals. The trouble is if the student have not signaled us, and with the amount of applications and signals that we receive, it's very unlikely that we'll be able to offer an interview. So I would say signal is probably one of the most important decisions for a student in applying for anesthesia, at least for now, with the way the 5 gold and 10 silvers are distributed per student. And I think my advice to the students would be, just make sure you thoroughly research each program. Is this the program that I want to be in? Is this the culture that I want to be in? Remember, going back to what we were discussing earlier, it's not just about the learning. What's the environment? I think environment, and how do you know about the environment? And get into social media, talk to the resident or the faculty, as much as possible. Do an audition rotation. So do your research. Is this the place that me and my family wants to be for the next 4 years or 3 years? And then you signal it very carefully. Do I have a relationship with this program? Would the program be interested in me? How competitive am I compared to the rest of the applicants? So there is a lot of, I think a good amount of insight is also important from the medical student side. And most medical schools, including VCU, would have an advisory panel, like a career guidance or a mentor from the medical school. And I think, they do a pretty good job in advising students in terms of how to choose your signal. So my advice is choose your signals very wisely and carefully. I'm curious what Laura and Mike has to say.
I remember the first year with the signaling, it was before even gold and silver. I think we had either a hair under, a hair over 2,000 applications. And it's been confusing as I've been a mentor to the medical students. Each year things have changed. And so at least things have kind of settled out. There are people that are just spectacular medical students. They have AOA, Gold Humanism, publications, presentations, national leadership things. And I know these people are going to go to one of their top 3 choices, depending on how they've gone through. It's hard to say, knowing that you're in that 6 to 15 on the rank list, that these people are going to actually come to your institution. Things get very confusing that how we offer our interviews and how we kind of evaluate people. And I do want to say that it's a holistic approach. How likely are you going to be to come to our program? I may want you so much to come to this program, and I'm just like, well, you're probably not. I just want to interview you just to hear some of your stories. But that may be taken away from somebody else. It's never just one thing that we're looking at. We look through all of the gold, we look through all of the silver, and we start our interview offers from there. And if we need to go down below that to people who haven't signaled us, we will. But it's rare that with the competitive nature, and I'd like to think how good our program is, that we don't go very far down our match list.
Yeah, I don't have much to add. I think Dr. Prasanna and Dr. Trostler covered it pretty thoroughly.
Great. And so now that these signals exist, do you find that letters of intent still have value for applicants prior or after receiving an interview? And if so, what is the best method to submit a letter of intent to your program?
Yeah, I think your best intent is the signal. I mean, that's what I would say. It's pretty obvious. And with this year's ARAS, you can also describe why you signal the program. So I think that's probably the best intent you can communicate to us about your interest in the program. Instead of sending an email, signal is the most powerful powerful indicator of your interest. Now, so I would say that if the student has not signaled us and sending a letter of intent, it's probably not going to be useful for both parties. Now, once you are interviewed, once you receive an interview invitation, once you're interviewed, yeah, we get a letter of intent all the time. Yeah, we're going to rank you here, we rank you too high, or you're very interested to match into your program. Those are obviously probably more useful for us. So that's just my take. I'm just curious what Mike, if Mike has any other comment on that.
I would say intent beforehand, and we've all received these, is not important at all. I'm going to review your application the same as I would without the letter of intent. Afterwards, it may be of some use, especially if you want to be specific about things. Check your letters, everything you send. Personal pet peeve of mine, misspellings and things that are not, when you generate your own form, not checking each part specifically. I've had letters just for my fellowship where they put in, instead of liver, they put in pain. And so I'm very interested in your pain program. And it's like, oh, I realized you just filled in a bunch of these underlined areas and you missed one. And that's very telling.
Yeah, we are very particular about attention to details, right? Anesthesiologists.
Yes.
Yeah, and for me, I think I think like Dr. Prasanna and Dr. Trassler said, it's really about the signaling. Letter of intent, I think, does help, whether it's, say after ASA and you meet us and there's a compelling story behind it, whether it's, you talk to some of our residents, you really learn more about the program, you didn't know about X, Y, and Z about our program, and now you have a newfound interest. Something like that definitely plays different than kind of a generic letter. But if you meet someone, if you talk to someone from our program, I think that makes a difference, and shows a reason why maybe we weren't in your top 15, but now maybe we are. But it's kind of a tough thing, whenever we're trying to pick the people that want to be here, versus, knowing that we are not in their top 15 is kind of like, there are all these people that do want to be here. So it's a little bit tougher. But in terms of letter of intent, I do weight those letters where they meet someone from our program and talk to someone and really learn about our program a little bit more heavy than someone that just sends a generic letter.
That makes sense. And thank you all for kind of clarifying. I think the signaling process brings a lot of anxiety for applicants and it can be kind of confusing. So we appreciate you kind of elaborating how you view that and how, applicants should be, like you said, Dr. Prasanna, using their signals as kind of their first line of demonstrating that interest in your program. And so, talking a little bit now about interviews themselves, from your perspective, how can applicants shine during virtual interviews? And additionally, how can applicants best get to know VCU's program without necessarily visiting in person?
Yeah, I can take that. In terms of the application or of the interview itself, I think basics, make sure that you have a good environment. You can speak clearly. I think some of the worst interviews I've seen where the microphone's not working, or you have to call them instead of doing the Zoom interview. So make sure all your equipment's working, I think, is the first thing. So cover all your bases there. Um, and then say you do have something that your um, application maybe not be completely, uh, the most stellar part of your application. For example, let's just say, your board scores were less than average. I would always say, anyone that has an interview, you're already in the door. So, use that experience, whether it's a low board score, and take that experience and show how you've grown from it. I think that's a lot of what we look for is a resident, like we keep talking about it, the well-rounded resident. Yes, you did have, less than average board score, but this is kind of the situation around it. This is how I grew from it. And these are the lessons I learned from it moving forward. So, things like that, I would just, for any applicant, there might be that one thing on your application that you really don't want to talk about, but my recommendation is figure out a way where you want to talk about it and, don't try and hide it. I wouldn't volunteer, X, Y, and Z situation, but if it comes up, make sure that you have something that you can talk about and show how you've grown from that situation. Um, but, um, but yeah, and I think also, a big thing is answering the question. So, if you're asked about yourself, it's a very open-ended question, always have an answer for that. So it's all about, how you kind of um, make those concise answers, answering the question, having a compelling story, those things that you can really work on before the interview process.
Yeah, I would just say, yeah, I totally agree with what Dr. Webb just said. I think one of the difficulty with this, most interviews are virtual these days, right? So you miss that in-person element. And if most medical schools, would provide like mock interviews to the students, and I mean, to be honest, yeah, there is definitely a difference among the students in terms of your interview skills. It's real. And in anesthesia community, interpersonal skills are super important. We're not we're not working in isolation. We are always working with people. So I think people skills are important. My advice to students are, get some mock interviews from some of your school of, medical school faculty, and ask them to be very candid with you, give the feedback. And if there are specific deficiencies in the interview, there are courses, there are, programs that you can attend and work on and fine tune your interview skills. Because as Laura said, every year we also have an R-Match program, and some of the R-Match applicants are the medical students who didn't match first time, and one of the common reason was the poor virtual interview skills. So it is real. So yeah, I think students should take that seriously and work on the deficiencies, if any. Thank you.
It's always helpful to be enthusiastic, genuine. It's hard to tell more on virtual than it is in person when someone genuinely wants to be there. But there are people that I just really enjoy and really wish we could extend the interviews to just talk with them. And that's what we're looking for. Whether it's working with surgeons and circulators and scrubs, or trying to get to know your patients in sometimes a few minutes or a few seconds as a trauma patient rolls in to try and set them at ease, interpersonal skills are very important to us. As far as anything else you can do, asking a generic question that comes off as generic or something that's covered when Dr. Prasanna talks about the program during the interview day is kind of one of those things. It's like, is it better to have any question? Well, try to find a specific question. Try and show some interest in whatever program you end up applying to and interviewing at. Know your program beforehand and have something that you're not trying to just ask and answer your own question. As far as getting to know the program without being here, there's a residency dinner. It is virtual, but you get to discuss the night before, similar to how it would be if we were still doing in-person interviews. So everyone can get together before the interview and ask their questions of the residents. Candid, not to videotape, not recorded in any way. You're allowed to find out what the program's actually like. Open house at ASA, social media. We have, I hope, thriving social media where we kind of add different things throughout the day for different events. Sometimes it's just what visitors have to get up to, and we start, some of our residents will just decide to get into the bunny suits, and we'll take a couple of pictures of just that and the whole process. And of course, an audition rotation is just an extra long interview. If you can find and talk to any prior graduates, prior attendings at VCU to find out what the program is like and what the whole atmosphere is, it's much harder than going in person. I found that invaluable, just even walking around the hospital to see how things were. I went to some places and the operating rooms looked like prison cells. We have, a couple of hallways that look out on different aspects of the city, and you'll see people hanging out in them to just get a little bit of sun. And so finding out what the actual atmosphere is outside of just the people, the physical atmosphere is a useful thing to ask about.
Great. Thank you so much for sharing that kind of comprehensive advice about interviews. And are there any opportunities for students kind of after they interview before submitting rank lists that your program offers, like a second look to kind of get to know the program better?
Yeah, so we do offer like an informal second look. So a lot of medical students every year they contact our chief residents and any resident pretty much, and you can come and visit us. This year we are looking into perhaps making a little more formal second look. One of the trouble is we interview so many people, and we got to be fair with everyone. We don't want to give an unfair advantage to anybody. So that's a piece that we are looking into this year. But yes, every year we have we allow students to come for a second look into, informal look after, especially after the interviews. Absolutely.
Great, thank you for sharing that. And then kind of to wrap up the questions about the residency application cycle, we mentioned that anesthesiology as a specialty is becoming so competitive these days. What advice do you have for those who are interested in anesthesiology who are not applying this year?
I think the best advice is really, when you're a med student, focusing on your grades first. So make sure you have a really good med school track, and make sure you're studying for your boards. At the end of the day, we want a well-rounded resident, but you also have to have that foundation. And again, when we're talking about being a well-rounded resident or being a well-rounded med student, we want to kind of emphasize, sometimes there are filters that you do have to put, with your board, whether it's board scores or, if you're looking at the MSPE, it does make a difference if you're, bottom quartile versus top quartile. So making sure that you have that foundation, I think is really important early on. It's totally different if, uh, you have all of these volunteer experience and everything, but then, you can't show the academic um, aptitude as well. So I would say first things first, focus on kind of studying, making sure you have all that foundation. And then after that, that's when you start looking into publications and all the extracurricular activities. And then also, I think we kind of mentioned it earlier, all of these audition rotations, or I guess they call them AIs, away rotations. They are auditions. They are basically, look at them as interviews. So every day, show up, make sure you're interested, make sure you know about your patient. I think, it does go a long way when I have a visiting med student. They know the patient. They've really integrated themselves already into the residency, knowing people, talking to different faculty. So I think that does play a significant role too when we're looking at prospective students.
It's hard with anesthesia. I never did any anesthesia as a medical student. It was an elective, and it was a lottery system, and I got put into radiology, which was very nice to sit in some very comfy chairs in the dark, but it was very hard to keep my eyes open as someone else scrolled through things. And I might have led a different career path if I had any of that early exposure or joined an anesthesia interest group. Anesthesia research is hard to come by in any real form, but there are posters and presentations, difficult cases that residents are always happy to have medical students come and help them write these things up. It's great exposure for you, helps make you a little more well-rounded. A presentation at ASA, poster, anything that you can actually get up and speak about is something that you could talk about at your interview and be like, well, I actually got up and presented and I asked questions and I had my answers. Remember, there's nothing more important than your grades. Start with that, your shelf scores. There's great inflation and so many people do so well that negative results really do stand out in a bad way. So you need that strong foundation, and then you need to move up from there. We look at volunteerism, especially underserved communities, to just become that well-rounded person that has something to talk about. On those ways, engagement. I see medical students come in and they don't ask to do anything. They don't really introduce themselves. And it's like, well, if I don't know that you know the patient, you don't get to do anything. You have to show me that you've put in the work, and then you get to shine by actually performing a procedure.
Yeah, I agree with Laura and Mike, what they just said. What I would add is I think context matters. For the students who are interested in these, know the strength and weakness of your own med school. Do you have a, pipeline for getting an anesthesia rotation in-house? Because a lot of med schools don't have anesthesia residency. So how do you network? How do you, you might want to start working on those things even earlier if you're interested in anesthesia. Do you have a research pipeline? within your med school curriculum. If not, you may want to look outside. The one piece that I would add, which is becoming more topical these days, is leadership. Like Anusha, you're in fact a great example for this leadership at a student level. And like ASA, there are many national societies, like for example IARS and ASRA. These anesthesia societies, they have a medical student component, and you can get involved in that even as early as as an M1 or M2. So, and this leadership piece is becoming an important part of your evaluation of every application. So I just want to put it out there, and this is becoming and there are more opportunities also nationally. You just need to ask and network. Thank you.
I agree. And I would say for our viewers watching that, the ASA website, the medical student component, we've put together a page that kind of highlights different leadership opportunities that we have available. So if you're interested, please check it out. We host elections every year at the annual meeting that's coming up, next week. And so that's a great place, if you're looking for ways to get involved and maybe your school doesn't have, an anesthesia interest group or, a similar program. And so talking a little bit more now about specifically VCU's anesthesia residency program, I know you mentioned different elements that you guys have talked about throughout this interview. Could you share a little bit more about some of these unique aspects, like your formal leadership training program, this longitudinal peer-to-peer mentorship program? What was kind of the decision process to include these programs in your residency, and what exactly do they entail?
So the leadership program is something that's fairly new, and it's something that I've tried to push forward after we had what we call Clifton Strengths. It's a strength-based leadership program. We don't focus on weaknesses, we focus on what we can do to leverage our strengths. And after our faculty participated in it, I thought, wow, this would be really good for something for our students, our residents, to help them become leaders and to focus on strengths. There's more engagement. It's very common in the business world to have these strength-based leadership programs. And we're not business, but it's a way of framing how we interact with people and what strengths we use to accomplish our goals. So we started out with this. We're going to be using it as part of our midterm evals, or some annual evaluations for our residents to try and push them forward. And it's been shown in other fields to provide more engagement, more excitement. Burnout is a fact of life in medicine. In anesthesia in particular, with our hyper focus on the patients, we're drilling down into this, whereas other specialties may have a broader perspective and they have 30 or 40 patients. Especially as a resident, you have your one patient in front of you in the operating room that you are just so hyper focused on, and it takes an amazing amount of mental energy. So to have this vocabulary about how we're using our strengths instead of what we're failing at, it's how am I leveraging my strengths to improve? We're very excited to see where this kind of progresses as we take this from what are your strengths, how do you use your strengths, and how do you use those strengths to become a better leader? Because that's what anesthesia is supposed to be. We're leaders in this perioperative home, amongst our colleagues, throughout the hospital. People are usually happy to see anesthesia when we walk through the doors for that reason. You couple that with our peer-to-peer mentorship, we're helping each other grow. The faculty, down to the resident, down to the junior resident, down to the intern. We use it for fun. I take them out for meals. They come to my house and we watch movies and have popcorn and candy in my theater. They come and they play with my children. We have different other events that we support or just facilitate. I think some of us are going to the Virginia State Fair today. And we're just going to meet up with whoever to just see some animal competitions and eat some fried food and ride on some rides. But then we're trying to figure out ways of also bringing in full events for the entire residency. What does your future hold? What are different fellowship options? What does private practice look like? To try and inform the residents of what their futures could be and how they kind of want to design it. So it's a real big expansion into not just the whole person holistic applicant, but we're trying to make everyone a little bit more well-rounded as they come out into practice.
Excellent. Thank you so much for sharing. Sounds amazing. Did anyone else have anything they wanted to add about either of those programs?
Yeah, I think, this is something, we were, even our faculty members go trained in the Clifton, the strength-based training. And we were just literally, we found it very useful. It's so insightful. And as Mike said, the leadership, the Clifton Strength Leadership training, the feedback that we received from our residents who gone through the training it's just very positive, and we want to continue that. And the second piece, as Mike said, is it's probably one of the biggest strengths of the program. It goes back to that community, the relationship between the faculty and the residents, and that's rooted in that mentorship, the culture of mentorship.
Absolutely. Thank you all for sharing that aspect. And then talking a little bit about VCU's approach to structuring didactic time for residents. What does that look like at your program, and what other components are included as part of your longitudinal curriculum?
Yeah, so I think one of our big strengths is really our didactic. Um, uh, we have a dedicated didactic day for our residents. So Thursdays, it alternates whether it's a CA1, CA2, CA3 class. We have focused didactics for each residency class. So you're not expected to do anything clinical. It's just all completely a protected day. So in the morning, typically what we do is 2 to 3 lectures. And I say lectures kind of lightly because we've now morphed into what's called the flipped classroom model. So it's really interactive, very collaborative. But those 3 lectures are in the morning, and then in the afternoon we do have sim labs, POCUS sessions, as well as we have a new oral board curriculum as well. So each Thursday is really focused towards each residency class, and it's great because you can really focus on being outside of the clinical realm, delving more into kind of the nitty gritty things that we do need to know as anesthesiologists. So it's a great I think aspect of our program, and being able to protect that day and be non-clinical for one day is great for our program.
And from my understanding, you also have a quality improvement and patient safety curriculum. Can any of you kind of elaborate a little bit more on how that's incorporated into the program and what that would look like as a resident?
Yeah, I can take that. So as anesthesiologists, we attendings, faculty, we know that we have as Mike alluded to earlier, we have a big impact on patient care. We are the leaders of patient, quality and safety. Even if, if you be it private practice or academic, we are at the forefront of safety and quality. And that's one of our job description. When you sign a contract with any of these practices, you are going to be the pillar of patient safety and quality. So we want to get our residents give a taste of how it is, and how impactful they can be in our own department and our own perioperative area. So that's kind of the general sort of vision. That was the vision for implementing this new curriculum. So it's longitudinal, so it spans from your internship and throughout your residency. So we start with a series of lectures from our Quality Academy, and we go over the fundamentals of patient safety and the different components of quality, how the quality metrics, the tools, the the root cause analysis, the Six Sigma. So we go through a very interesting fundamentals. And then in your CA2 year is where all the fun happens. So every resident is expected to they're welcome to create their own QI projects, or they can join with a faculty member. And some of these QI projects are very significant, have significant impact on our patient care. And I'm sure if you walk into any anesthesia department, there's probably like 50 things that we could do better, like today. So there is, and it is so fascinating to see how our residents come up with these projects and ideas to further the quality and safety of our patient care. And in the fourth year, the final year, they will be presenting, publishing the results. The vision is to give them a patient safety and quality, like a scholarship certificate at the end. It's not just about the certificate, but it is definitely one extra thing on your CV. And it just, I think the real deal is the experience to go through this, learning the fundamentals and applying it in real life and seeing the impact on patient care.
I want to emphasize that this is not just something there's no point to. It's not an exercise in futility or just to do something, because we've made changes based on this literally within the first year of these projects. We have updated the medications in our trauma bay to be more conducive to the updated guidelines. We have improved our warming systems in the PACU to prevent hypothermia. We're actually doing things that actually impact patient care and our lives as anesthesiologists. We've made our lives easier to make our patient care better. So we're not trying to do a project that doesn't end up with any result.
Yeah, no, that's great to hear. And, like you guys are saying, patient safety is such a critical component of this specialty. And so it's wonderful to hear that your program is kind of giving space for your residents to really dive into that, come up with some of their own projects, and then implementing that at your institution itself and giving them those skills to then take wherever they go in the future and continue doing that. I love that you guys have that. And so I think those were all of the questions that we had for you all this morning. And so is there any last thoughts or anything that anyone wanted to add before I wrap up?
Well, thank you, Anusha, again for this wonderful opportunity. And I hope this session is useful for medical students and their future anesthesiologists. They're welcome to, if they have any questions, they can visit our website, can contact any of us or our program coordinators or, any residents. I think we talked about the learning and the growth, and we incorporate that into our own program's culture. We're also learning and we're also growing. It's a constantly, evolving and dynamic program, as Laura and Mike, they're at the forefront of all these changes. And a lot of these changes that we are making and we will be making is based on resident feedback and faculty feedback. And that's sort of the culture of the program. We don't want to be static. We want to be constantly improvising and fine-tuning.
One of my mentors told me, the day you stop learning and growing is the day you should retire. And I try and practice that way.
Yes, well, thank you, Anusha. We really do appreciate you taking the time and having this platform to show med students and prospective residents, what we do have to offer. And I do welcome any other resident or prospective resident. Please reach out if you have any other questions. We're always open to hearing and discussing with you.
Yeah, and thank you again to the three of you for, making the time to do this. It's really invaluable advice that you're providing to future applicants. And for those of you who are viewing, if you have additional questions, like I mentioned, feel free to reach out, as well as check out VCU's website online for more information about the residency program. And then also check out the ASA Medical Student Component homepage if you want to get more information on how to get involved, as well as we have additional interviews with different program directors for you to view. So thank you.
Thank you.
Nisha.